Good morning, everyone. Thank you for tuning in. Thank you for the media for being here. My name is Eric Beaton. I'm the Chief Operating Officer for Ballot Health. I wanted to give you one of our weekly updates, bi-weekly updates. So first of all, let me say thank you so much to our community. It's been some amazing generosity of businesses providing some free PPE, personal protection equipment to us. I particularly want to say thank you to Harbor Freight, to American Electric Power, to J. Mark Wall and Ceiling, and to Lowe's for their generous donations and all that they're doing to help us during these trying times. Also, I want to say thank you to Best Uniforms. They donated a number of nursing scrubs for our team members. It's greatly appreciated. So thank you all for doing that. Yesterday, Monday, Governor Bill Lee and Governor Ralph Northam both issued orders to stay at home. Ballot Health completely and fully supports these orders. It's very important that we pay attention to that. This is the best opportunity we have to bend the curve of new cases going throughout our community. We're starting to see community spread happen now. These orders should not be taken lightly. It's very important that we adhere to them. Stay at home. If you have to go to work, do that, but please return home and do not congregate with other people at this time. Only leave your home for essential business and essential travel that you have, and again, it's our best weapon against avoiding and having additional cases of COVID-19 in our community. An update on our PPE or personal protection equipment. We're cautiously optimistic about our preparation there. We continue to work very hard to make sure that we're having the equipment that we will need to take care of patients and also to protect our team members during this time. We're working very diligently to increase the stock levels of several different items today. We're working with also our local providers, physician groups in the area who need PPE as well. We're helping them have access to buying some equipment that they may have a need of, particularly around N95 masks that you've heard a lot about. We're able to help them purchase through our buying power that we have as an organization, and we are working very diligently with other providers to help them have the equipment that they need as well. We are expecting a pretty sizable shipment on Monday of PPE to help us continue to support our team members across the region. Let me update you on visitation restrictions. As of Sunday, March 29th, we are only allowing one visitor now in our neonatal intensive care unit at Nice Longer Children's Hospital, as well as rooms with pediatric patients in them throughout the healthcare system. The approved visitor must be a parent or a guardian. And again, this is just out of an abundance of caution to ensure we restrict and try and stop any type of spread that may happen, particularly in our children and our labor and delivery areas. Labor and delivery units will continue to have, as we've had in the past, only one designated visitor per room. The visitors that do go to these units will be subject to screening before entering to ensure that they are healthy and are able to visit without creating additional burden. No visitors are not permitted in our inpatient units, our long-term care facilities, or our behavioral health units. We are making exceptions under extenuating circumstances, and we'll do that on a case-by-case basis. At this time, let me turn it over to Jamie Swift, our Corporate Director for Infection Prevention, for an update. Jamie.
Thanks, Eric, and obviously thanks to our media for covering this again today. So I'm here obviously to give you an update on our numbers. On our state websites, there are 57 confirmed cases in our region. And I know y'all see that, but we certainly want to reiterate that 24-hour period. And so that's 15 additional cases that we had seen from the past 24 hours. So we're continuing to see an increase of our cases day by day. I'm sure as numbers come out today at 3 on the Tennessee Department of Health and as Virginia releases, there will be more. And so it's really important for people to understand our case count continues to go up. Our age ranges, while we've certainly focused on that 21 to 40, and we have that age range, we have 12 that are in the age range within our ballot testing. We're starting to see community spread, and so we're now also starting to see that age group over 50 be affected within our region. So of our ballot cases, as of this morning, 11 were now over the age of 50. So it's really important for people to understand this is affecting all age ranges throughout our community. We are reporting our first death from Ballot Health today. We're reporting that to the Department of Health, and you'll see that number reflected. We certainly express our deepest sympathies to that family, and we want the community to understand we will start seeing that as cases go up. It's really important that, to help us and to prevent that from happening, that we're flattening that curve, that we're staying at home. We have our governor's orders, our mayor's orders, and so we really need to take seriously now the stay-at-home orders. And then to switch real quick, there's been a lot of questions about team member testing and team member exposures and how we handle that. So we are certainly providing that service to our team members and our physicians. If there's exposure and there's reason to test based on epidemiological criteria, we're providing that service to our team members. If someone is tested because they're symptomatic, they are put off work. So they are quarantined. We're working with the Department of Health in both states to make sure that we're handling those appropriately. If they test negative, certainly they will return to work. And then if we have positives, we work with the Department of Health as those people are quarantined for their certain times, and then we'll bring them back to work under the guidance of the Department of Health. And at this point in time, I will introduce Alan.
Thanks, Jamie. Good morning. My name is Alan Levine. I'm the Chairman and CEO of Ballot Health. I want to talk about a couple of issues. Number one, I want to reiterate what Jamie just reported, that we've now had a death. This was, without getting into identifying information, this was very tragic. Obviously, any death during this event is tragic. Our prayers are with the family, but also with the team members. It's a very different environment right now, where you have a situation where a patient dies and doesn't have the family around them. We were able to get a family member to be with this person in their final moments. But this is obviously very consequential on our team members who do deal with these issues routinely, but it's different when they're the ones there for the last rites, and they're the ones there dealing with a situation like this. So Eric and the emergency operations group here is in the process right now of deploying some assets to provide support to our team members who might need it. I'm going to come back to that in a minute. We're watching what's happening at Vanderbilt University Medical Center. We know that they've reported they have 86 team members that have been impacted by the virus themselves. We have had 4 as of right now. All 4 are doing well. 1 has already come back to work. I think we anticipate there will be more. There's all types of ways and reasons why team members end up getting exposed, which gets to why it's so important for us to avoid people being in the hospital that don't need to be in the hospital. There's a lot of discussions about team members that are idle right now because of the volume declines that we've seen because of the reduction in elective procedures. It's not in the best interest of those team members necessarily to be in the hospital, which is part of why we're being so assertive with flexing our staff down, because we don't want people to be in the hospital who do not need to be there. I want to talk a little bit about mental health. I don't think that there's been enough discussed. I think we've seen stories of increases in rates of suicide, increases in rates of alcohol abuse, child abuse. These things are natural. They're natural occurrences in the face of a disaster, and certainly when you have people that are dealing with financial insecurity, the worry of someone in your family getting sick, losing your income and not knowing if the income's going to be there later, being concerned about whether you can afford care in the event that somebody in your family is affected. And those are all legitimate concerns. Those are very legitimate feelings that you have. And it is not a sign of weakness to seek help. It's a sign of strength. And if you feel that you need help coping with this, please, whether it's Frontier, go to the CDC website, the Centers for Disease Control. There are phone numbers there. Ballot Health will be posting multiple phone numbers and places for you to go to for help. Talk to somebody. When we're in this thing. It's a marathon. It's not a sprint. The president has said that he's encouraging social distancing through the end of April. This could go on beyond April. But for right now, we know that social distancing is the policy of the land until the end of April at least. And And so whatever you're feeling now, it's not going to get better by itself in the next 30 days. So if you feel you're having struggles coping, I think now's a great time to reach out for some help. Talk to somebody. There's some websites you can go to. The National Alliance on Mental Illness, the Centers for Disease Control, and as I mentioned, Ballot Health will put some information on our websites. And we certainly encourage all the media outlets to provide contact information for help, so that wherever people get information, whether it's social media, print media, or television or radio, they can find this information without looking too hard for it. And that's something I would ask all of our local media to do. This is real. I mean, the impact of this can be very real, and it can be devastatingly tragic if people don't seek help. So I want to bring you back to that. Our team is working right now on surge plans. I think it's important to know that. A lot of questions that we're getting are, gee, what are you gonna do? Do you have enough ventilators? Do you have enough ICU beds? And the reality is, if we don't do everything we can do to avoid the spread or mitigate the spread, then the answer is clearly no. There's not enough capacity. That's why it's so important, and why Eric has repeated it over and over again. It's why the governors have said it. It's why our local leaders have said it. It's not a joke. It's not for fun. Nobody likes to see what's happening right now, both in terms of our economy and what it's doing to families in terms of isolation. However, the more we can decrease the spread and slow it down, the better the likelihood is that we'll have the capacity when we need it. Right now, our strategy is, as a regional health system with direct control over all of our assets, we have the ability to have an integrated, coordinated approach. So, if people present with symptoms, we have a strategy for caring for people within their communities as much as possible. Certainly while they're negative, if they're determined to be positive, but their symptoms are very low, then we still can care for them in those transitionary facilities throughout the region. We have capacity, COVID units that we have stood up. Right now at Holston Valley and at Johnson City Medical Center, we can expand that to some other facilities as the need arises. We have more than 230 beds available to us for what we call COVID beds. We have we've provided premium pay for our nursing staff that are providing care in those COVID units. We recognize the increased risk those staff members are taking, and we wanted to make sure that, certainly it's not about money, but we wanted to make sure that they understood that we understand the additional risk that they've taken, and we certainly have provided premium pay for that. And I will say, at the moment, we have not found any other systems that are doing that. I mean, we've been very assertive about trying to make sure we recognize the risk that our staff are taking. I want to close off my comments and go to questions, but before I do that, I do want to reiterate what Eric said. You can see you sometimes in a trying time like the spread of an infectious disease, you can see the best of people and you can see the worst of people. And by and large, we're seeing the best of people, whether it's people that just put signs in front of the hospital saying, "Heroes work here," or volunteering to make masks. My own daughter was at home last night. When I went to bed at 1:30 in the morning, she was sewing masks with her. She and her classmates in the physician assistant program are doing that. Now, I will say the masks that she was sewing are not meant for use because it was terrible. But she's working on it. But God bless everybody who's out there trying to make a difference in the way they know how to do it. That's the best of people. The worst of people is those who go on social media and spread rumors, make accusations that are unfounded, and say things and that are just not helpful. What I encourage people to do, and this goes back to the issue of coping, it's not helpful if you're dealing with a disaster or a tragedy or an infectious disease event like this. It's not helpful for your own coping mechanisms to get information from bad sources and to focus on that. Go to reliable, trusted sources. Do not let yourself get sucked in to that social media vortex where people, without any accountability, put information out there that's not true, and it serves to scare people. It's not good. It's not helpful. It's not healthy. And I don't think it necessarily is serving any common purpose. So I would encourage people to focus on the facts, focus on what reliable sources of information are telling you, and give us a chance to beat this thing by all of us just being the best we can all be. I'm going to go ahead and open it up now for questions and hopefully be able to answer them for you.
All right, Taryn Young with the Coalfield Progress. Do you have any?
Yeah. Could you give us an update on what's going on at Lonesome Pine Hospital? Do you have any patients there yet?
Yes, we've had a couple of patients. The good news is I believe they both tested negative. So the system there is working, you know, where your lower acuity patients, they go there, we have them isolated there. That way Norton Community Hospital can continue to function as a full service community hospital, providing all the services that are needed. So far it's worked well, exactly as planned. As I was mentioning earlier, you know, we've been doing modeling to look at what our capacity issues will be over the next 40 to 70 days. And we certainly believe, based on the spread, based on the doubling rates that we're seeing, that we're going to have use for these assets and this capacity. So we're glad that we've stood this up. And frankly, I will say I'm grateful to Governor Northam, the governor of Virginia, yesterday. During his briefing, he very specifically called out Ballot Health and the work that our team has done there in Wise County to stand it up. I think he pointed to it as an example of innovation and trying to be responsive to this disease. It's a similar approach that we've taken in Greene County, Tennessee, with Tacoma, and I think hopefully that as we go forward, we'll see some productive use of those facilities in a way that that serves those communities well.
Taryn, do you have an additional question?
No, that was my only question.
No? Okay, thank you so much. Next, we have John Engel with WCYB.
Hey, just looking for any additional clarification you can give us. I know that you can't release a lot of information about the death because of privacy issues, but are you able to at least tell us Northeast Tennessee or Southwest Virginia, or specify which division of the health department you would be reporting this case to?
John, the question is, can we provide more detail about the patient in terms of where the patient was from or which state we would be reporting it to? At this point, the answer is no, until we get a better idea of how the states want us to handle that. I will say it was a gentleman that was over the age of 70 who had multiple comorbidities, but it was a pretty fast demise of this patient, and it was everything that we've been told to expect when you have patients who fit that profile.
And just to clarify that point, are you able to say if that case involving that gentleman was travel related or believed to be community spread?
John, the question is whether this was a travel-related case or community spread. I don't really know that right now, but we can try to follow up and get you that answer, John. I don't have that off the top of my head.
All right, thank you.
And if I could just put this out, I was trying to combine those. Sorry, Megan. We had thousands of doctors in Tennessee yesterday respond to Governor Lee's stay-at-home order. After that came out saying that it still doesn't go far enough. The dean of the Cologne College of Medicine is called for a full shelter-in-place as well. Where's your stance? Has it evolved at all since your comments last week? Do you think we need to require, not urge, people to stay home?
It's not. It's certainly. I think the governor is reacting and making decisions based on the information that he has, and as well as what the governor's done. Our local leaders have taken actions locally. I think what the governor was trying to say, having watched his comments yesterday, I think what the governor's trying to say is whether he orders it and it's enforceable, or the effectiveness of the enforcement mechanisms. I think those are the things he's grappling with. The bottom line is, if you knowingly put yourself in a position to spread this disease, that is the definition of abject stupidity. I just don't know how more clearly to say it. This is a disease that's killing people. We've seen how horrible the symptoms are for many people who get it. And so if you whether you're ordered by a governor or not, if you put yourself in a position to unnecessarily expose yourself or other people, then you're just not being smart. And I just don't, there's just no more clear way to say it. You know, myself, my team, we're trying to practice distancing. Frankly, in many parts of the day, I'm actually working from home and providing communication with my team from home for that very reason. We're trying to minimize the exposure because we all want to make sure we don't. Imagine if you're the person that's responsible because you came into contact with 15 people and 5 of those people are elderly and 3 of those 5 people die and you were responsible for that. How would you feel about that? And so you know, whether the governor orders it or not, it's up to each of us to be responsible, and I really think that was his message. I'm not in a position to tell the governor what he should or shouldn't do. I do encourage him to continue to communicate forcefully how important it is for people to protect their neighbors and to protect their communities by not putting themselves in a position to either get this disease or unknowingly spread it.
Thank you. Next, we have Richard Lovett with Cumulus Radio. Richard, do you have any questions, or have you dropped off?
No, I'm still here, Megan. Just have one question for either Alan or perhaps Jamie. As we're seeing evidence of community spread, no doubt more people may want to get tested that may meet the criteria. Are you all confident that your testing capacity will be up to par, if you will, if there is an increase?
We believe the mechanisms we've been using to test the public have been effective in terms of using our screening process, just by virtue of the fact that you know, we've had almost 15,000 calls, and we're watching those cases that we test and what percentage of those that we test are testing positive. So in terms of our process, I mean, we're following the CDC guidance for how we deploy testing. As to the effectiveness of testing generally, I would tell you, I think that has been nationally a failure. You know, the most important thing in epidemiology is testing to identify those who have it, isolating them, and tracing to make sure we contact everyone they've come into contact with. This is an age-old model for reducing the spread of an infectious disease. There's no rocket science to it. We've been using it for 100 years. It works well. If you're not able to test people and get results back quickly, it affects your ability to effectuate that model. So the fact that Abbott has moved so quickly to get point of care or point of site testing within 5 or 10 minutes is great. They're obviously trying to mass produce that test. Right now, as it stands, whatever capacity is out there for speeding up the testing is being it's being directed to the hotspots as more of a priority right now by the federal government. We understand the logic for that, but it does place us at a disadvantage in areas that have not yet been hit hard as we're trying to prevent the spread. So as fast as we can get, whether it's Cepheid labs with the reagents that we've been expecting to have delivered to us, which would give us the ability to turn testing around within hours, or getting the Abbott technology out and deployed into en masse throughout the country, both of those things will be very helpful in speeding up the identification of people who are positive so that we can isolate and then do the tracing. The tracing is a really important part of this. And I will also say we've been having dialogue with the departments of health about ways we can assist them as more cases are positive. They're obviously going to run into capacity issues with their own staff in terms of their ability to do the tracing. So Ballot Health has reached out to the health departments to offer to provide some of our staffing support to the health departments. So as they need it, we can provide some additional manpower to the health department so that we can continue to do the tracing. The tracing is a really important part. Once you've identified somebody who's high risk or who has it, it's a really important part of mitigating the spread because you make contact with everyone that person has had contact with. And every one of those people that you can get out of circulation, you're reducing the risk of spread for another 15 to 20 people. So it's really important that we do provide that support. and certainly we're here to help the health departments as they need it.
Richard, did you have an additional question, or was that it?
Just one more, and any idea of when things may hit the top of that curve, either here or nationally?
Well, I don't want to. I'll let others who are qualified to look at the national data report on the national data. What we're doing, and that's a great question. We've taken the national models, the numerical models that have been put out by, I don't know whether it's Hopkins or Pennsylvania, or whatever the different sources are. We're looking at those different models, and our team of folks locally. We've engaged Dr. David Reagan, who formerly was the Chief Medical Officer of the Tennessee Department of Health. We're working with Dr. Reagan, with Dr. Runnels, Dr. Vashist, our internal physicians, as well as our population health leadership, to take those models and apply those models to what we are seeing locally and using assumptions. So for instance, I think we're using 6-day doubling and then taking that data and applying it to what we think the likely spread will be based on that doubling. And then of course we're looking at the severity of our population. We have a disproportionate number of people who have lung disease, cardiovascular disease. And so what percentage spread will we see? And then what of those who do test positive, what percent of those will need hospitalization, and what percent of those will likely need intensive care level of care, and then what percent of those will need ventilator support. So we're using a very science-based approach to the modeling, and basically what we're seeing is, assuming nothing changes and we continue on the path that we're on, we're probably looking at hitting our capacity probably within 40 to 70 days. Now, that doesn't mean that's a done deal. If we're successful with pushing the rate of spread down by effective social distancing, then we're in a position to push that capacity, the need to hit the capacity out further. And so that's why we're so focused on this message of continuing to socially distance, because just because we're modeling that 40 to 70 days we could hit our capacity, that doesn't mean that has to be the case. That's if nothing changes and we don't get even better at reducing the spread. So what our team is working on internally, and I know this isn't necessarily what you asked, but I think this is probably where the next question is going to be. So assuming nothing changes and we hit our capacity, what then? What happens after we hit our capacity for ventilators and ICU beds? We have teams working right now on what those different projections look like and what the modeling would look like in terms of creating additional capacity. We've been working with East Tennessee State University. We met yesterday with the Army Corps of Engineers. We're doing a lot of planning right now to have discussion about how we would create additional capacity if the need should be. So what I would hope the community would hear from that is, while we're dealing with what's in front of us right now, our team is already leaning into 70 days from now and 80 days from now so that we can be prepared in the event we hit those volumes. So we're doing a lot of what-if scenarios, and we're taking that data and we're using that data to inform our decisions.
Thank you, Richard. Next, we have Richard Rourke with the Irwin Record. Richard, did you drop off, or do you have any questions? All right. Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Yes, just have a question about Mr. Levine. You mentioned Tacoma and the things you all are doing in Tacoma. I just would be interested in that.
Well,
what modifications maybe you're making.
Okay, the question is, what is the current status of Tacoma? And it hasn't changed. We're planning to use that as a transitional facility, possibly for COVID patients. Because of the things we had done in Greenville prior to all this, we're in a perfect position to utilize that capacity with minimal disruption. So patients who do not have COVID would continue to be able to use Greenville Community Hospital, the formerly known as Laughlin Regional Medical Center, and then those other patients who are likely or at risk of COVID or who are testing positive for COVID would be treated at Tacoma. And so that's the plan. We've got significant capacity there, at least a capacity of 55, could go up to 100. And we're actually doing some work right now on what we can do with some of those rooms if we needed to expand the capacity more in terms of converting them to negative pressure flow and stuff like that. So again, a lot of the planning we're doing isn't for what's happening this week, it's for what may happen in the next 40 to 70 days.
Eugenia, do you have another question?
Okay, no, thank you.
Okay, thank you so much. Next we have Febin with WJHL. Febin, do you have any questions?
Yes, I do, thank you. Alan, does Valid have they decided on where a quarantine/isolation hospital will be?
Yeah, as we've been discussing, we've got several facilities that we've repurposed, one at Lonesome Pine in Wise County, one in Greenville. I'll just refer you to my previous comments.
Febin, do you have an additional question?
No, that's about it.
Okay, thank you so much. And then last we have Scott Robertson with the Business Journal. Scott, do you have any questions? All right, well, thank you all so much. That concludes our press conference. Thank you.
Thank you.